Now, each year, more than 2,000 Australians are diagnosed with sarcoma, which is one of our rarer cancers. Joining
Wow.
us, I know, yeah, it's so rare. Now, and we are so fortunate to be joined by Dr. Jeremy Lewitt, who is an oncologist at the Peter MacCallum Cancer Centre, so that we can discuss Sarcoma Awareness Month. Thank you so much for joining us this morning, Jeremy.
Good morning. Thanks for having me on board for this important topic.
Absolutely. Now, first of all, given how rare this cancer is, can you explain what sarcoma is?
Yeah, so sarcoma is a rare and complex group of cancers that can develop in the body's supporting structures. So supporting structures are the things that keep you upright, like your bone, your muscle, your fat, cartilage, or soft tissues. And it only makes up about 1% of all the types of cancers that we see each year, but there are over 100 different subtypes, each needing its own different type of treatment plan. And because it can start anywhere in the body, it's often very hard to detect, especially early.
Jeremy, it's quite interesting when you look at sort of cancers in young children. Why is it that sarcoma seems to affect young adults so much?
Yeah, so sarcoma can affect anyone. Let's just start by saying that, from babies all the way to the elderly. But it is, as you said, much more common in young people aged between 15 and 25. And it seems to be more common in these adolescent years because this is a time period where there's lots of cell turnover, such as, bone as a result of puberty. And so that's why we tend to see a bit of a peak rise within this age group. But it's also one of the hardest to treat in this age group. And sadly, approximately 30 young Australians die each year from sarcoma within this age.
Jeremy, what's the difference between that word oma, of course, which is, I don't know, is it Latin or Greek meaning tumour? What's the difference between lipoma and sarcoma?
So lipoma, whenever we're talking about those 100 different subtypes, we try and look at the cell of origin. Okay. So lipoma originates from fat cells. Okay. And fat cells can have benign types of changes, such as lipoma, which many of us, may have as you get older. We tend to notice that a lot more.
Sure.
But when it becomes cancerous is where we add the word sarcoma. So it can become a much more aggressive type. And so the cancer version of lipoma can turn into something called liposarcoma, which is one of the more common types of cancers we see in sarcoma elderly.
Okay, thank you.
And so what would be the treatment for something like this? Because obviously at the Peter MacCallum Cancer Centre, you really dig down and try to give those tools to people. But what do we do here?
Yeah, treatment can look very different between people and the specific subtype. As you can imagine, with 100 different subtypes, each has their own very specific nuances. So, the broad principles is that it can include surgery, chemotherapy and radiation. And I'd like listeners to recognise that if caught early, some sarcomas we just treat with surgery alone. It's really important to identify these things early. But for some of our more aggressive types, like bone cancers, which tend to occur in young people, treatment can last 6 to 9 months or longer using a combination of treatments, particularly chemotherapy. And as you can imagine, that may have considerable impacts both in the short and long term for a young population.
Jeremy, one of the issues in all these types of things is getting the word out there and having people understand to listen to their body and find out. Do you have ambassadorial roles? Do you have someone out there saying, now look, I've got this issue and this is what's going on, get to learn a bit more about it? Do you have that sort of thing?
I mean, certainly we have a very strong consumer network trying to sort of get the message out there, and that's why programs such as these are really, really important.
Sure.
But I would, make sure that it's important for our listeners to understand what to look for, not just from an ambassadorial perspective, but if you're noticing changes in your body, it's really important to not sit on them.
Yes.
So, particularly with many of our sarcomas, it's important to look out for those sort of red flag symptoms, such as pain or swelling or a lump that doesn't go away, and particularly after like a sports injury or a minor knock that just doesn't seem to resolve. So I would certainly encourage listeners today, if anything seems unusual or persistent, it's best to see a GP who can evaluate things further.
Yes.
And if needed, there are sarcoma specialist centres, and there's a list of that on the Australian and New Zealand Sarcoma Association website. Wonderful. To really get that specialist level of evaluation.
Terrific.
Well, thank you so much for joining us this morning, Dr. Jeremy Lewitt.
Thank you so much. Really appreciate it.
Thank you.
From the Peter MacCallum Centre. And if you would like some more information on the Peter MacCallum Cancer Centre and their adolescent and young adult cancer services, you